Hello, this is our wellness lecture, and this is Dr. Kavya Malani. I will be talking today about three things, but the most important thing for today would be weight loss and the medical management of weight loss. As you know, the obesity is a major concern in the US at this time, and it has to do with the overconsumption of food, sugars, fatty food, the whole industrial food production. But also, it has to do with the lack of physical activity. So in general, people are assuming 1 pound or 2 pounds of weight per year, and that weight is accumulating on them and has become a more difficult issue in terms of public policy, public health, and all kinds of public policy discussions that come up about taxing or not taxing sugary drinks, etc. The most important thing is that the appetites of people does go up when you're exposed to more food, and as we've discussed this before, the key issue is the balance between calorie restriction and exercise. The thing that I want to talk about today, which is very interesting and very important, is that there are a lot of new kind of amazing programs that involve walking. So a lot of people just think of walking as a boring exercise, but there are amazing walking programs, walking apps that can allow a significant amount of weight loss. Running obviously is a good exercise and gives cardiovascular fitness, it decreases mortality, it does stress the heart, and that's a good thing. But in walking compared to running, walkers have an advantage, and the advantage is actually a further decline in mortality compared to runners. And that has to do probably with the dislodging of cholesterol plaques, and possibly also with increased strain on the heart. So again, for weight loss, I do recommend a regimen of walking. We have really not talked about walking in of itself as a form of exercise to lose weight. So imagine that basically we have a program for exercise that's fantastic, and we engage that. Well, how much should one walk? Well, walking needs to involve one long walk, possibly on the weekends, something like 4 miles or 5 miles, and 2 miles potentially on weekdays with a frequency of every other day. So like, for example, a schedule of Monday, Wednesday, Friday, 2 miles and a 4 to 5 mile fast walk on a Saturday or Sunday will respond very favorably, and the weight will go down and the patient will decrease blood pressure, will improve in diabetes, abdominal growth will go down, and people will have a lot more energy and a lot more vibrancy, and that's amazing. So for some people, if they want to do that kind of exercise, that is very suitable. For some people, they may feel they want to do a little more, and then they could add a block or two of a sprint in between. This way, the physical activity does engage people. It does allow for a significant amount of weight loss over the long term, and it is doable. The most important thing about any exercise program, including a walking program, is that it has to be practical and it has to be doable. So it has to fit into the confines of a very busy life in Fairfax County or in Northern Virginia or anywhere else. So the walking that I would recommend is a Monday, Wednesday, Friday schedule, potentially with 2 miles per day, potentially with 1 block of running in between, and then in general, a long walk of 4 to 5 miles on the weekends. So 1 long walk. So out of 7 days of the week, basically these 4 days can be amazingly used in a very non-aggressive, non-damaging, kind to the knees form of exercise that is really good for the heart and does actually decrease mortality. The other thing that's really not used at all, and I really think there's a significant need for it, are planks. And planks are basically exercises that are held, positions that are held, like the sit-up position or the push-up position, that basically you hold the position for a duration of about 30 seconds to a minute. And those are static, and they are, in a sense, you don't have to move. You hold the position and have to hold the correct position. And that posture with a straight back and the arms fold on the elbows, that really allows for a significant amount of muscle buildup and strengthens the core And that basically allows people to do kind of when they are even not exercising to lose a lot of weight. So a combination of fast walking and a package of put together with core exercises such as planks will be beneficial and very healthy for a sane and manageable weight loss. This is Dr. Kavya Melani for Virginia Medical Updates, and I look forward to seeing you in other sections of the program.